It would look great in a Lamborghini. October is ending now, Breast Cancer Awareness Month. 200,000 new cases of breast cancer will be diagnosed this year. 40,000 women will die. Remember, men get breast cancer also. So are there some things that we can really do to cut down on our risk of getting breast cancer? Yes, there are. There are several things. Number one is the old problem of smoking. If you smoke, there's an increased incidence of breast cancer. So if you're smoking and if you think you're addicted to it, talk that over with your doctor. Get away from the smoking. Drinking alcohol. In our society, alcohol is a common thing. We have a beer, we have a drink, but the more that we drink, the greater chances are of getting breast cancer. So no smoking and no drinking. We stay active. So if you exercise and stay active, there's less chance of getting breast cancer. Watch your weight. A dense breast, large breast, breasts of people that are overweight and inactive, they're the people that have problems with increased breast cancer. If you have a baby, breastfeed. We know that breastfeeding cuts down on breast cancer later on. Be very, very careful about radiation. If you get a chest x-ray with a little nodule, be careful that radiation to the chest or environmental radiation or radiation. We're getting better at diagnosing, but the more often that you have X radiation, the greater chances of getting breast cancer. So there's some things that you can do. It's basically stay healthy, stay active, check your family history, and accordingly with your doctor, get your mammograms at that age. Otherwise, start at 40 and get your mammograms regular. And now questions from the viewer. Dr. Bob, it's a good question. Can GERD, esophageal reflux disease, cause heart attacks? Well, no, it can't cause heart attacks. However, the pain of reflux, esophageal reflux, you swallow food, comes back up into the esophagus. It can cause the esophagus to go into spasm. And the same nerve endings that supply the heart will end up supplying the esophagus. So you can get a pressure crushing pain right in the middle of the chest that mimics a heart attack just because of reflux. So watch your weight, cut down on eating before you go to bed. If you have to, go to your doctor and get appropriate medicines. GERD can mimic heart attacks, but doesn't cause heart attacks. And now Leslie and Sean, back to you. It's a great Sunday. Hope everyone has a good time and stay healthy.